Perhaps let me just dive straight in to what needs to be done first. And I'm sure it's been said, but clearly the first thing that needs to happen is for government to state clearly how fundamental good nutrition is for economic growth and development. And it's very difficult, I think, to imagine a set of government interventions that will dramatically change, for example, stunting levels in South Africa in the short time, because of the structural underpinnings that we've spoken about today. But there are things that can be done. And the starting point is to prioritize resource allocation. I mean, let's put it bluntly. If we have to choose between 1 more rand into higher education or 1 more rand into nutrition, we must put it into the latter. If we have to put in 1 more rand into an NHI, quite frankly, or putting it into nutrition, we have to put it into the latter. So if we start to address the structural drivers of stunting, we have to home in on food value chains for children, particularly in informal settlements, and define that food value chain in terms of nutrition. Then I think if we think like that, that will start to bring together a number of players. And then as I picked up at the end of the conversation here, we have to engage with the food industry on at least an affordable basket of 10 nutritional foods, eggs, legumes, pilchards, etc., where while we protect the primary supplier, we have to find a way to reduce the markup or eliminate the markup on that essential basket of foods. But then the community response is what is so important. And here we have to find ways to provide more direct support to local community enterprises that are supporting food production. I think of Tanda in southern KwaZulu-Natal, where a rural cooperative feeds the farmers' families and also generates food for local sale. But this is not just about food, and we make a mistake if we think it is. And so we have to capitalize on the value of community health workers who provide mental health support, who provide nutrition advice, particularly in food-constrained environments. At the moment, much of their time has been spent on medicines compliance, on palliative care, yet the biggest value of community health workers actually is in maternal health care and support and nutrition. And finally, let me just say, Mark, I think it's time that we as a country stop vacillating about food supplementation for young children. Yes, there is a program, but I think it's patchily implemented across the provinces. Where children are crossing centiles, we must investigate why, we must try and get to the underlying cause. But when children continue to fail to thrive, we have to respond by ensuring that they have adequate nutrition. We can't say that we can't invest in early nutrition because we don't have the resources. We've heard that inequality drives stunting, stunting drives inequality, and a powerful way to break that cycle is to invest in early nutrition as a core strategy for economic productivity and economic growth. Thanks, Mark.
Thank you very much, Dave.